Welcome to Caregiver's Note, a podcast on childhood disorders and other mental health conditions. The views expressed in this podcast do not serve as medical advice. I am your host, Dr Tema, and this is episode 4, titled The Real Work Management Approach of ADHD 2. Below is a highlight of points that will be covered in this episode. First, therapeutic support by allied medical professionals. Second, the caregiver's input. Third, school or academic support. Therapeutic support by allied medical professionals. The value of therapeutic support by allied medical professionals should not be undermined. They include occupational therapists, psychologists, social workers, just to name a few. Their therapeutic interventions are particularly key in long-term self-management. They are implemented directly with the child as support to caregivers or through the school. They do not serve as substitute for medication, especially where there's a clear indication. The specifics of therapeutic interventions required and available should be discussed with the primary clinicians, as the needs would vary from one child to the other. There will be times when, as a caregiver, you would be confronted with multiple opinions, even from allied medical professionals, about their negative experiences with medications. It is unfortunate that at times personal views by allied medical professionals, especially against medications, are discussed with patients and caregivers. This fosters serious anxiety and confusion, best left for discussions among clinical colleagues. The caregiver's input. The bedrock of management of children with ADHD is their caregivers. Their frustrations is unimaginable. It is therefore common for caregivers to be emotionally depleted and to experience anxiety and even depression, especially in cases where their children have not commenced on any form of intervention. There are a few things, if applied consistently, that can make parenting a child with ADHD a little easier. The first is making sure that medication is taken consistently. That is, the adult caregiver managing medication. It does not make sense to entrust the child with ADHD, whose hallmark is forgetfulness, to take medication regularly on their own. Once consistency of medication is established, the rest of the support needed for the child with ADHD is much more manageable. The next is established routine as a form of discipline. This includes a variety of activities of daily living, including sleeping, chores, meals, homework, screen time, to mention just a few. Ask any caregiver whose child has untreated ADHD how challenging it is to do this. The third one is regular contact with mental health care professionals. Experience has showed us that caregivers who discontinue contact with mental health care support teams are likely to discontinue treatment. This, however, does not make ADHD go away. If anything, the problems of ADHD become worse with time. As we shall hear in our future podcast, why bother? 2 long-term effects of ADHD. The fourth is that it helps for caregivers to stay in regular contact with teachers and not wait for that dreaded call from the school when a child has been disruptive. This goes a long way in nurturing relationships with teachers who will, in many cases, go out of their way to support children and give useful feedback. School or academic support. The disruptive behaviors and inattention difficulties that come with ADHD will negatively affect effective learning. These behaviors will be experienced daily by the teachers and to some extent peers. Teachers, as facilitators of learning in school, are vital to the team of support for children with ADHD and to their caregivers. The demands put on them to extend support for children with ADHD are immense. This is regardless of the number of children in class, though obviously worse for those with higher numbers. There are many considerations to remember with regards to support for children with ADHD in school. One such important aspect of academic support is concessions or academic accommodation. The various support measures made available will depend on the learner's needs. The support should be made readily available to assist children with ADHD to thrive in school by scaffolding some of their deficits. This kind of support will go a long way to ease their challenges in school. Currently, very few caregivers, particularly those with access to resources, are aware of these options available for their children with specific academic difficulties. The academic accommodations have not been well promoted outside of urban areas. This has left greater part of the population of children disadvantaged. Teachers should be acutely aware of such disabilities and promptly direct caregivers to seek out appropriate assessment required for this academic accommodation. That said, it is important for children with ADHD to be assessed on medication. That is, for those already recommended to do so. This will give the best picture of their baseline needs. As part of support for caregivers of children with ADHD, it is immensely helpful when teachers manage feedback constructively. The red pen comments in the children's diaries are not helpful. At best, experienced as aggressive and often perceived as quite threatening. The derogatory names used to describe children with behaviors should at best be avoided. For instance, naughty, troublesome, just to mention a few. These do not encourage necessary and warm alliances between teachers and caregivers. It is possible in some instances that this is born out of frustration on the part of teachers when caregivers are not responsive or there are some delays to act on behaviors reported earlier. To summarize what we have just presented, the contribution from allied medical professionals in support of children with ADHD and their caregivers is immense. Caregivers hold threat of support but stand the risk of mental health conditions themselves due to burnout, especially if their children's ADHD is not managed. The value of collaboration between caregivers and teachers is immeasurable for children with ADHD, the backdrop of which is constructive and open communication. Academic accommodations will assist children with ADHD that have been identified to have specific learning problems. In conclusion, the cost of managing ADHD, be it direct or indirect, in both private and government facilities is quite high. This is, however, not comparable with the cost of inadequately managed ADHD, whose devastating consequences are longer lasting, if not lifetime. The required investment in the resources of management of ADHD children is highly variable between rural and urban areas, despite their similar experiences of consequences of the condition. Thank you for listening to Caregiver's Note. Do check out our website at www.nsztema.co.za for more resources, our contacts, and the author's profile. Please remember the views expressed in this podcast do not serve as medical advice. Always check with your clinician for any medical concerns or clarity. If you liked this episode, please remember to share the link with those who could benefit from it. Tune in to our next episode when we look at why bother, the dimensions affected by ADHD.